High blood pressure, no longer a death sentence. If you live in the US or Europe, here's what you need to know. Voiceover. Across the United States and Europe, high blood pressure, often called the silent killer, continues to be a top driver of heart attacks, strokes, and early death. But a new multinational study, led by researchers at Tulane University in the US, using extensive data from the UK Biobank, has uncovered a hopeful solution. Published in Precision Clinical Medicine, the 14-year study tracked over 294,000 people, including more than 70,000 individuals living with hypertension. The key finding? People with high blood pressure in the US, UK, and Europe can dramatically reduce or even eliminate their risk of early death by managing a specific group of 8 health risk factors. These include blood pressure itself, body weight, cholesterol, blood sugar, kidney function, smoking status, physical activity, and waist size. Participants who improved at least 4 of these markers lived as long as those without high blood pressure. For Americans and Europeans battling lifestyle diseases, this study represents a clear call to action and a roadmap toward a longer, healthier life. Healthcare professionals across the US and Europe are now paying closer attention to how various health indicators, not just blood pressure, predict long-term survival. The Tulane-led study identified 8 interconnected health risks that, if managed properly, significantly reduce early mortality. Blood pressure, body mass index, BMI, waist circumference, LDL bad cholesterol, blood sugar levels, kidney function, smoking habits, and daily physical activity. For example, Americans and Europeans often consume high-sodium diets and live increasingly sedentary lifestyles, both of which raise blood pressure and expand waistlines. In nations like Germany, France, and the US, cardiovascular disease remains the #1 cause of death. This study shows that addressing even 4 of these 8 factors can entirely neutralize the heightened death risk from hypertension. These findings challenge the outdated idea that blood pressure medication alone is sufficient. Instead, a proactive, lifestyle-driven approach is key, a philosophy already gaining traction in modern Western healthcare circles through wellness programs, nutritional education, and fitness interventions. In the United States and Europe, healthcare access may be advanced, but lifestyle-related conditions are on the rise. This research brings good news. Even modest improvements in your health stack up fast. For every single risk factor controlled, the study found a 13% reduction in overall risk of early death, a 12% decrease in cancer-related deaths, and a powerful 21% reduction in cardiovascular deaths, which are disproportionately high in the West. Whether it's replacing sugary snacks with whole foods, walking 30 minutes a day, or quitting cigarettes, each action can have a major impact. Americans in particular struggle with obesity and poor diet, while many Europeans face rising metabolic syndrome due to processed food intake and urban inactivity. This study sends a strong message. You don't need to do everything at once, but you must begin. Even if you control just 4 out of the 8 listed health metrics, your longevity outlook can match that of someone without hypertension. For millions across Western countries, this could be the breakthrough that turns routine medical checkups into life-saving interventions. Why most Westerners fail to address these risks and how you can break the mold. Here's the shocking reality. Only 7% of individuals with high blood pressure in the study had 7 or more health risk factors under control. That means over 90% of hypertensive patients in the US, UK, and Europe are still vulnerable to early death, despite the tools available. The reason? Healthcare in the West often emphasizes prescription drugs over comprehensive lifestyle coaching. Patients are handed pills for blood pressure, but rarely offered sustained support for weight loss, smoking cessation, or fitness. Meanwhile, insurance and public health systems are just beginning to fund preventive care. But the data couldn't be clearer. Optimal risk control, defined as managing at least 7 out of 8 factors, reduced risk of early death by 40%, cancer deaths by 39%, and deaths from heart disease by a staggering 53%. The opportunity here is enormous. Whether you're in New York or Naples, Berlin or Boston, your health destiny is still yours to shape. This study proves that with informed choices, you can beat the odds, even in today's high-pressure, high-stress Western environment. U.S. and EU doctors rethink the standard hypertension treatment model. Western medicine is entering a new chapter, thanks to findings like these. Traditionally, managing hypertension in places like the U.S., France, and the U.K. meant simply prescribing medication and checking blood pressure during annual exams. But this approach is now under serious review. Dr. Lou Key, a respected American researcher and professor at Tulane University, emphasizes that hypertension doesn't act in isolation. It interacts with nearly every other organ system and lifestyle pattern. Controlling blood pressure alone isn't enough. Addressing risk factors individually helps eliminate premature mortality, he explains. This statement resonates strongly with a growing number of integrative care physicians across Europe and North America who advocate for diet, exercise, and emotional wellness as foundational tools in disease prevention. Expect Western health guidelines to evolve in response to this study, placing more weight on holistic care plans and patient accountability. With chronic illness rates soaring across the U.S. and Europe, especially among aging populations, this shift is not just smart, it's essential. Your action plan for a longer life, if you live in the U.S., U.K., or EU. Whether you're living in Los Angeles, London, or Lisbon, the time to act is now. If you've been diagnosed with high blood pressure or are on the edge of metabolic syndrome, you are not powerless. Start by tracking your waist size, understanding your cholesterol levels, and making sustainable changes like quitting smoking or adding a daily walk to your routine. Request comprehensive lab work from your doctor and insist on a plan that covers all 8 risk areas. Share this study's findings with your family, especially older loved ones. In the Western world, where fast food, long work hours, and screen addiction are common, taking charge of your own health is one of the most revolutionary and empowering acts you can make. The science now supports it. By controlling your health risks, you don't just improve your blood pressure, you dramatically extend your life expectancy and quality of life. In America and Europe alike, the future of medicine is proactive, personalized, and preventive. The decision to live longer begins with you. So now you know the science is clear and the choice is yours. If you're living in the US, the UK, Germany, France, or anywhere across Europe or North America, this message is for you. Your health is not a fixed fate. It's a future you can shape. High blood pressure no longer has to mean early death. Not if you take action today. You don't need to be perfect. You just need to begin. Improve even a few of these key health markers and your risk can drop dramatically. If this video opened your eyes or could help someone you care about, please don't scroll away. Like this video, share it, and subscribe. When you do, you're not just helping yourself. You're helping others in your community live longer, healthier lives. Let's build a world where we don't just treat illness, we prevent it. Because whether you're in Boston or Berlin, Manchester or Madrid, your life is worth protecting. Hit like, subscribe, and start changing your future today. Yes, darling, again, hit like, subscribe, and start changing your future today.